All right.
Hey, everybody, we are now live, and Dr. Cooley and I are thrilled that you're joining us for another episode of the Metabochondriacs. Today, we've got a kind of a broad topic, but once you kind of hear it all, it's going to narrow down, and you're going to realize that you might not have ever heard of advanced glycation end products, or abbreviated as AGEs, before, but it is actually rooted in the basics of what we would call metabolic health. I'm going to just give a quick anecdote with all of this from my corporate wellness background, Ryan. And then I'm going to jump into what we talked about a minute ago. And then if you want to give your anecdote you mentioned that you had with that. So, one of the failures in my understanding, having been in the pharma business, spending 10 years in corporate wellness and disease management, 12 actually in two different companies, that one of the failures of what's going on in our healthcare world, and it spills over into the corporate wellness, is we don't measure insulin resistance. We might give a fasting glucose, but it's rare that most corporate wellness companies will also do an A1C, and it's rare that many primary care internal medicine doctors will do a hemoglobin A1C, which is, if you're ever told about that you have glycation going on in your body, it's from those blood tests, the A1C. But many times it doesn't get expanded upon that if your A1C is coming up, well, that's usually advanced disease in your body, because it tends to take 10 to 15 years of insulin resistance before glucose levels start moving up and that A1C levels start moving up. So, because we kind of leave this as a stealthy little thing, this insulin resistance manifesting into the body until it becomes more serious things, well, we're about to go through in a couple minutes here what are 30 of the top conditions that insulin resistance and high glucose levels in your blood, and even if they're just spikes that wind up coming down over time, wind up resulting in your body. So before I turn it over to Ryan on the intro, if you've been following on my channel, the My Metabolic Life channel, you've seen that I've been introducing people to the word idiopathic, and that a great deal of the primary care internal medicine diagnoses that happen are idiopathic hypertension, idiopathic prediabetes, idiopathic type 2 diabetes. Now, Ryan and I are pretty firm, but I'll let him say if he disagrees with my statement here at all, believers in that it's insulin resistance run amok, high levels of glucose, high levels of insulin for years being undetected until it starts creeping up into an A1C that is really the root cause of these things. But the definition of idiopathic is Latin for of unknown origin. And this kind of keeps everybody in the dark, you as a patient, many times the doctor, because it's a constant reminder to the doctor, yeah, we don't know what causes these things. They are idiopathic in nature. When I'm a firm believer in, we know what's causing all 30 of these things that we're going to go through briefly on the slides here. And you should be looking out for, if you or a family member or a friend or a loved one as ever doctors are talking to you about any of these 30 things, you can start realizing that this is insulin resistance run amok, uncontrolled for years. And it really is kind of a glucose and sugar and fructose situation going on in the body. So I'm going to leave it there at the end of the presentation. The other thing I mentioned, Ryan, with the tenderizing of meat, I'll end that story at the end. But if you want to play off of anything I said before we start introducing the 30 most common things that are a result of excess sugar in the bloodstream, I'll give it to you.
Yeah, I mean, it's a great point about idiopathic. I think, the problem with the idiopathic, and it's not that it's inappropriate, because there are conditions where we don't know the
Yes.
cause or the mechanism behind the condition, and then it's appropriate to perhaps have that term. But when new knowledge comes about and things move just so slowly, in healthcare, then that's kind of frustrating, because you have then slow adoption of more specific coding of healthcare diagnoses. And well, I think from a care perspective, the end result is just suboptimal care, right? If we say that someone has idiopathic hypertension or essential hypertension, basically the same thing. What we're saying is we don't know the cause, right? But we now know that. And when that information isn't more uniformly disseminated to healthcare providers, people are getting suboptimal care then, right? Because then many healthcare providers aren't looking for what we now know is the predominant cause of hypertension today, and that's insulin resistance and metabolic dysfunction. And a good example in my world and in the arrhythmia world relates to something called idiopathic PVCs, which are premature ventricular beats. And we are now seeing epidemic levels of PVCs. It used to be a very rare consultation. When I first started in practice 25 years ago, it was pretty rare to get consultations for idiopathic PVCs. And within the world of idiopathic PVCs, having a PVC originate from the outside of the heart, which is called the epicardium, was extremely rare. And now it's commonplace. So
in what period of time has it become that you now see it commonplace?
Over the last couple of decades.
Okay.
I now get consultations for PVCs on a weekly basis. And many of them are these epicardial foci, which are very difficult to get rid of. And no one that I know of has connected the dots that this increased incidence and prevalence has mirrored the obesity and diabetes epidemic, right? And it makes complete sense that, and this is what I see. This is what I see now. I mean, I'm a clinician. I see patterns, right? And when I see PVCs, I now, because I started to see this, I now test everybody, right? And it's the same thing. I mentioned this with atrial fibrillation, that we were seeing a very high prevalence of insulin resistance in an unselected AF population. We're seeing the same thing in PVCs, right? And what is insulin resistance a marker of? Visceral adiposity. Where does the fat tissue accumulate around the heart? On the outside. Where does it accumulate? Around the great vessels and around the base of the ventricles, which is where these epicardial PVC foci originate. So the funny story, that I have related to patient care is that I will now test people for this. I will now recommend fat loss as a first strategy. Mm-hmm. And sometimes patients look at me like I'm crazy because no one else is telling them this. And I've had a couple of patients seek second opinions and have the alternate opinion that this is an idiopathic PVC and there's only one fix for it, which is ablation therapy. So they undergo ablation therapy, and I can remember 2 recent cases where it was unsuccessful. And so then they came back to me for lifestyle modification to help them with their PVC problem. So I just think there is the potential that idiopathic diagnoses, when new knowledge isn't appreciated or forthcoming, that it could lead to very suboptimal care. So that's my idiopathic anecdote. But I'm super stoked to talk about this because I think that the healthcare community wants to, they want information. I mean, this is an absolutely universal thing that I see in patients in the clinic, is that they're really, really seeking, as most information as they can. And a lot of times they don't get that information, and they leave the clinic with a very incomplete picture of kind of what the problem is and what's going on in their bodies, and the extent of what's going on in their bodies. And I think this is just a great topic, and something that we want to bring to the forefront, that is happening physiologically in the body when you have insulin resistance, and you have elevated glucose. What we don't know is, at least I don't know this yet. Maybe there's somebody that has information about this, but I mean, it's clear when you have elevated fasting glucose or elevated A1C that you are getting glycation going on in the body, glycation of proteins. And we can talk about what's going on cardiovascularly and how important it is. And Brett can also go into some of the other areas where AGEs have an impact. But I'm curious to know kind of what's happening in insulin resistance when people have relatively unremarkable A1Cs, right? Is there something about insulin resistance that causes a pattern of glucose dysregulation that doesn't manifest in an abnormal A1C that could still be driving AGE formation and cardiovascular risk?
I would say absolutely, because we know that the many of these things that we're going to start talking about here as we go through the list, and this is just the definition of advanced glycation end products. We'll get to that in a second, or this is the definition. But many of these things that people are seeing, they're seeing before they're even being diagnosed diabetic, when we realize that they're most likely from being diabetic, just undiagnosed. And just like, and I forgot to mention to you, but one of our personal heroes, Dr. Kraft, with the Kraft insulin test, I have his book now, but he's the one who donned, and we misquoted this a couple episodes ago, that if you have heart disease and you're an undiagnosed diabetic, that actually came from Dr. Kraft. That was him, and I think we attributed it to Gerald Revens at the time. But anyhow, not that that's. But things are going on.
If you look at the European Society of Cardiology's position paper titled "LDL Causes Atherosclerosis," they discuss in there, and they diagram that LDL has to be modified to begin the atherosclerosis process, right? And there's basically two structural alterations that happen. There's glycation and there's oxidation. Mm-hmm. So we can kind of go into those two things a little bit, and there is an interrelationship between the two, but they are also independent, right? You don't need glycation to have oxidation of lipoproteins, which could begin the process. Glycation accelerates it, for sure, right? So there's an acceleration, an enhancement, if you will, through the process of glycation. But a lot of people just poo-poo this insulin resistance thing if their glucose isn't elevated. And I think that's my point. My concern is that we don't really know, if there's a degree of harmful effect and downstream effect of insulin resistance related to glucose metabolism and homeostasis that is causing glycation and oxidation. Insulin resistance is a chronic inflammatory state that is associated with oxidative stress and the potential of oxidation processes. But if you have, let's say, an A1C of 5, does that mean you're not having glycation? And I think the answer is we don't know, but I think it's very possible that you still are, because the Kraft study, the Kraft test basically shows a different patterns of response to a glucose load. And so there are some people who have patterns that are associated with very abnormal glucose excursion, but they may not have chronically basally high glucose.
But they have high enough insulin, which we're not measuring and tracking and doing that Kraft insulin test, that the insulin resistance isn't going to happen if you're not chronically spiking the heck out of your glucose. Because if people do what you and I do, we go like this, just nice even glucose all the day long and nice even insulin all day long. Thus, the insulin resistance resolves itself. So you can't have high insulin without having high glucose first, without having a dysfunction in the pancreas, creating insulin spikes not related to glucose.
Yeah, I mean, that's right. That's correct. So the glucose homeostasis is going to partly drive that.
Okay.
Partly.
So anyhow, we're both on the same page. Insulin resistance is a major driver of what's going on here. Glucose is a major. Let me just quick read this description for those that, if it's small on your screen. Advanced glycation end products, AGEs, form when sugars react to non-enzymatically with proteins, lipids, nucleic acids, leading to the formation of harmful compounds that accumulate in tissues over time. This process, known as glycation, is accelerated hyperglycemia, oxidative stress, and aging. AGEs have numerous detrimental effects on the body, especially when present at high levels. And that's the definition from ChatGPT, folks. And it says there, here are the top 10 AGEs that negatively impact various body systems. So what I did was I went into ChatGPT and I said, please give me first top 10, and then the next 10, and the next 10. So we got 30 of these. And this is how ChatGPT laid out the medical research, or the totality of the medical literature regarding advanced glycation end products. So the first three that it came out with in order of importance: accelerated aging, so which is going to result in skin and connective tissue wrinkles, loss of elasticity, overall skin aging, joints, stiffness, and impaired mobility. I'll let you tackle number 2, being our resident cardiologist.
Yeah, so what happens is when you have elevated glucose in the plasma, also circulating in the plasma are lipoproteins. The most famous of which is LDL, or we can use the term ApoB. So ApoB are lipoproteins with an ApoB 100 protein on them. And so there's this non-enzymatic reaction between the glucose and certain amino acid residues on the ApoB protein, which gives you a molecule that then rearranges to a somewhat stable product called an amidori product. And so this product, though, is vulnerable to a transformation that is irreversible. And that transformation occurs when you have an oxygen, elemental oxygen or free radical, oxygen-free radicals. But even if you don't have that environment of high free radicals, the glycation process itself can form free radicals that predispose this amidori product to transform. And what it's transforming into is a highly reactive species, which is that's what the AGE is. So you can think of it as this, basically it's an LDL being modified at the level of the ApoB protein, and it's being modified in a way that it becomes highly reactive. And that sometimes is referred to as an AGE LDL. And we also know that insulin resistance, for example, so which is going to be the number one reason why somebody has elevated glucose in their bloodstream is insulin resistance. insulin resistance associates with more small, dense LDL particles, and they are much more prone to this glycation and eventual AGE formation. So you can imagine that patients with insulin resistance have elevated glyc, ApoB, or AGE LDL. And what you see in diabetic patients in atherosclerotic plaque is AGE LDLs. So that's the mechanism behind the formation there, which is again related to this glucose problem and glycation, the process of glycation. And then if you're also in the setting of oxidative stress, it's going to be double whammy, right? That whole process is going to be accelerated. But it's important to note that even if you didn't have elevated oxidative stress, just that glycation process alone can increase the free radical formation, which results in that AGE process which is irreversible, right? You just don't want to have that happen. And then what happens is now you've got plasma LDL transformation. The problem with that is that those particles are more easily transcytosed, they're more easily brought into the endothelial cell, more than large, buoyant, unaltered LDL. So again, the problem with a lot of the studies that have been done is that we've never really been able to separate elevated LDL or elevated ApoB from metabolic or genetic lipid dysregulation until recently.
Yep.
The lean mass hyperresponder group. Thank God for them. And so you've got this accelerated transcytosis. You have receptors around the cardiovascular system called RAGE, receptors for AGEs, which are enhanced and interact with these particles. And that has downstream molecular pathways that promote thrombogenesis, so blood clot formation, promote inflammation. So this is just a terrible milieu that these particles are stuck in now, right? And that's why insulin resistance and diabetes has such a profound hazard ratio for cardiovascular outcomes compared to just LDL-C.
Anything else. 20, 30 times more than any other risk factor.
Compared to anything else is because everything that could go wrong in your cardiovascular system, from endothelial dysfunction to inflammation to blood clot formation to retention to increased transcytosis and localization of the LDL within the intima of the vessel, to retention, there's less efflux of these particles out of there. Everything that could go wrong is going wrong. And you wonder why insulin resistance and diabetes have such a profound rate of cardiovascular disease, right? There's no mystery here.
Absolutely. So, and I, as you and I have shared back and forth, Ben Bickman, BYU professor, PhD, has a great little advanced glycation talking about the RAGEs and the receptors on the cells and all of that. I will put that in the show notes for anybody who'd like to kind of back up what Ryan was saying there, that's now well documented. Let's move on to number 3. And we're not going to spend as much time as we just did on cardiovascular damage there. We're going to fly through most of these, but I'm going to
give people a perspective of all of the things that AGEs contribute to, all the things that people are going in to see healthcare providers for. They have their roots in AGEs and in metabolic dysfunction.
Absolutely. That's our going to be, again, we're going to circle back at the end, and we try to make that point at the beginning. What you're seeing here represents 95% of what people go to the doctor for, and thus kind of has a common theme through it. Now, myself, I work for a kidney disease management company, so nephropathy, damage to the kidney. So our ability to filter the blood through the nephrons in the kidneys, the glomeruli, they get damaged just like everything else. In fact, 70% of chronic kidney disease and people that advance with an EGFR down to 15 to needing dialysis, 70% of that is because they're diabetic. It's just, that's what it is. The other 20% of it is from high blood pressure, which we know the root cause of that is the same insulin resistance root cause as the diabetes. There's some genetic aspects still in there, which tend to do cysts, but we're now finding that ketogenic diets also remove the cysts from those. So pretty much all three things that are going on inside of the kidney. If you're dropping that glucose and sugar level down, it resolves. We're going to go to number 4 and number 5. So nerve damage, neuropathy instead of nephropathy. There's a couple of them that are going to sound similar in here. But yes, our nerves, and this is a result of diabetic neuropathy characterized by numbness, tingling, and pain, particularly in the hands and the feet. Severe neuropathy can lead to a loss of sensation and increased risk of injuries. So again, right along with the whole diabetes we've talked about already, many of these things are just side effects or other factors going hand in hand with the not reversing the diabetes, managing the diabetes, keeping people at levels over a 6.5 instead of driving them down into the low 5 to 5.5 range or 4s. I have many people that have been on my podcast who have been able to reverse their diabetes and maintain it for 10, 15 years in the high 4 A1C level. Ryan, you want to take the next one?
Yeah, another apathy. Retinopathy is the term for eye damage, and the nerves, as Brett said, and the eyes are especially because it's a lot of vasculature in the eye. If you've ever been to an eye doctor and they do a photo retina exam and they show you the picture of a retina, you can see the incredible display of the circulation in the retina. So it's very dependent on appropriate vascular function because it's highly vascular. But these AGEs can damage that microvasculature and contribute, as we talked about in the cardiovascular system, to oxidative stress, and that's going to affect the retinal cells. Anytime you disturb the physiology, you're going to run the risk of cellular dysfunction and damage to the cells and death to cells. And in the eye, you get retinopathy, which is, leads to visual problems, blindness. It's a huge problem in the diabetic population.
Absolutely. So increases, number 6 in the list of 30 is increased oxidative stress. And as Ryan mentioned very eloquently in the beginning, that, where's the damage to the LDL coming from? It's coming from either the glycation of it or from the oxidative stress. And there's a number of different things that can cause oxidative stress. And one of the things I'll just quick tie into here is that really getting micro-viewed on this, but this level of detail will be very telling in just a minute here. Reactive oxygen species, ROS, also in the layman term, kind of free radicals is another way of saying that. Much of, you can be a heavy duty endurance exerciser, you can be running marathons, you can be putting yourself under an awful lot of oxidative stress through these types of things. However, from a metabolic standpoint, when you get into the Krebs cycle and you're looking at the electron transport chain and how the body is using fuel for energy, to create ATP at the end of that electron transport chain. I'll just use my fist here. There's 5 complexes in the electron transport chain. 95% of the reactive oxygen species, thus oxidative stress coming from our metabolism, is when we are metabolizing glucose as the energy fuel in the mitochondria. When we are doing complex 2, which is where the fatty acids and ketones come in to be used as energy, almost zero reactive oxygen species and oxidative stress coming from that. So here again is the correlation between, and I'm not saying that you're never going to want, because there are, our red blood cells don't have mitochondria. They can't come. They don't have a second complex to use for fatty acids. They only have glycolysis to use for all of this. However, most of the cells of our body, in fact, almost all of the cells of our body that aren't red blood cells, can use either or, and you're going to get much less reactive oxygen species by burning fats. That's why the heart loves the fat. If somebody's in ketosis and they have a PET scan, the heart doesn't even show up on the PET scans because it's just burning purely ketones and fatty acids, which is its preferred fuels. Anyhow, so that's mine on oxidative stress. We also have chronic inflammation and cognitive impairment and neurodegeneration. Ryan already said that,
And the chronic inflammation, sometimes people, that we use this term, oh, you're inflamed, or we just kind of throw out this term chronic inflammation. Well, what the hell does that mean? Right? It's just this nebulous thing. But here we've actually outlined a pathway by which this happens. And, if you really want to go into that, there's plenty of papers, scientific, writings that describe these downstream pathways of this RAGE receptor activation, if you will. But I think, one of the interesting things for me on the chronic inflammatory perspective was that, personally, I was insulin resistant. You all know my story. I think I was insulin resistant. I had an abnormal Kraft test. I had abnormal glucose metabolism, probably had AGEs. And I had 2 non-cardiac conditions basically go into remission. They're not gone. I don't think that, my eating a certain way, which, definitely reduced inflammation, because, and it's so interesting how inflammation can just, people often talk about, well, I changed this diet and now I feel really good. I just feel better, right? Well, is that chronic inflammation that you just feel lousy? Is your arthritis terrible because you're chronically inflamed, and then you reduce that inflammation and your arthritis is now it's still there, but it's quiet. It's sort of in remission, right? Well, so I had asthma and psoriasis, 2 conditions that are not linked, right? So if they're not mechanistically linked, but they go into remission, it's got to be related to chronic inflammation, maybe specific food items that were, having some contributory factor from an inflammatory perspective. But to me, that's what's amazing about this whole journey, and what I've seen is that asthma and psoriasis in remission. I think it's just chronic inflammation. Absolutely.
And it's amazing how many people live in chronic inflammation without realizing it. Yes, there are a number of medications that can also contribute to it, trying to solve other issues going on. But it's amazing on how many people, when I'm coaching and I'm talking and interviewing people on the channel, where they didn't realize as many problems as they had until suddenly all that chronic inflammation is gone, and they this cleared up, that cleared up, and 30 things are now, I thought it was everybody, my doctor kept saying, well, you're getting older. No, aging doesn't have to mean impairment unless you keep poisoning yourself continuously through times. So the next one here, and we'll just touch on this briefly. We're going to go through many of the rest of them much quicker, but cognitive impairment and neurodegeneration. And so here we're right in the Alzheimer's and the Parkinson's world. And one thing that we do know, and you can ask ChatGPT and go into this anywhere and find all the studies that relate to this. But one of the brain's defense mechanisms for high glucose, because while the brain does need glucose, and we create all of it in the liver that we need through a mechanism called gluconeogenesis, when it spikes high, it now is toxic for the brain, and it has to get rid of it. The brain has to get back to homeostasis, has to come down to a normal glucose level. And one of its defense mechanisms is it can convert super high glucose into fructose. Now you have to say, well, geez, if you've heard some of our other presentations, Brett, fructose is only metabolized in the liver. How is that fructose getting back from the brain through the blood-brain barrier to the liver? It doesn't. The next thing that the body does through various enzymes is it converts that fructose into amyloid beta plaques. And that's what we've been studying for decades now, as far as how do we get rid of these things and where are they coming from? Well, they're coming from excessive glucose that makes it into the brain, and the brain says, we don't need this much here, it's going to do damage. It's creating insulin resistance, and which was also why especially everywhere else in Europe other than the United States, we have a problem saying that, yes, Alzheimer's is type 3 diabetes. But those amyloid plaques are coming from, and you can check this out, go proof me and double check me anywhere. You will find AI will give you the studies that the high glucose goes to fructose, goes to amyloid plaques. And it is this insulin resistance that is happening in the brain that is contributing to both of these conditions and cognitive decline, memory loss. This is really critical. Anything to add before I jump to the next area, Ryan?
Yeah, I think also that I want to double check this, but I think that ceramide production is also a downstream effect of too much fructose and the activation of the polyol pathway. And ceramides have been linked to insulin resistance.
Absolutely. And so, and now, and you keep seeing, as we keep going through these, kind of all the reoccurring things that we think of people that have serious advanced diabetes, impaired wound healing. So, I mean, we hear of all the time people getting toes cut off, their feet cut off, amputations, because this high glucose level in the blood just doesn't allow, not only does it aggravate things, but it doesn't allow healing to happen either. If you don't solve this diabetes issue, this glucose level, you're going to run the risk of gangrene. This happened to my grandmother. Gangrene in the hospital. They were, saying, 80 years old, we're going to have to amputate the leg. She actually prayed herself to death in 48 hours over all of this, worrying about being a burden to the family. And then also there's negative impact on the bone. It leads to risk of fractures, osteoporosis. We're going to keep moving on here.
They didn't put this in there. They didn't put this in there, but on the wound healing side of it, it's another effect of RAGE activation is immune cell dysfunction. So there are pathways once that RAGE, you just don't want to be, why we have RAGE, I don't know, but you don't want to be activating or increasing those receptors, which glycated proteins do result in, but you don't want to be stimulating those receptors excessively because you get immune cell dysfunctions, which can impact wound healing.
Well, and I'll just play off of that just for a quick 10 seconds. Basically, the RAGE is the receptors that are on what Ryan's referring to there in the body. Every receptor on every cell of your body is made out of a protein. And so every receptor on every cell in every organ in your body is susceptible to this advanced glycation end product scenario happening here. So number 11, hormonal dysregulation. Ages can alter hormone receptors and signaling pathways, affecting balance of the effectiveness of our hormones. We start seeing things coming out into here with the thyroids, reproductive issues, signaling molecules and such, insulin signaling within the body. Would you like to just go through quickly compromised immune function?
I think we just talked about that. It states it right there. Actually, I didn't even realize I was getting ahead of myself.
Go
So
ahead and
rage,
jump on lung damage and respiratory issues.
yeah. So lung damage again related to age, accumulates in the lung tissue, promotes inflammation, fibrosis. Ages are just bad news in every organ. Any organ that is dependent on protein function. COPD linked to it. Asthma. There you go. Asthma. I had it. Pulmonary fibrosis even. Yeah, keep going.
Absolutely. GI damage. So what do we have more of in this world than everybody being diagnosed with irritable bowel, SIBO, leaky gut, colitis, diverticulitis, all of these different things going on. We're doing damage to the lining of our digestive tract, people. And this is creating so many things that are happening within us. Go ahead and take altered blood clotting. This is up your path.
Yeah, we mentioned this earlier. So there's an increased predisposition to thrombosis or blood clot formation, which is related to that RAGE activation from the ages. There's effects on clotting factors and nitric oxide, which is a vasodilating molecule. All that just predisposing to increased coagulation. Right? Most MIs, DVTs, strokes are blood clot conditions, hypercoagulability.
And while we've already touched on skin, I'll let you just quick take this one too, because I think you have something that you said you reversed in here yourself.
Yeah, psoriasis, and it's listed there. This is awesome. I didn't even read through in great detail your list here, but to see my own personal problems, I was always wondering, okay, why did these things go away? And here it is. It's the effects of ages. I'm sure I had ages with my history. So yeah, keep going. Yeah, cancer.
Okay, number 17, go ahead. And you can take 17 and 18 both.
I'm certainly not a cancer expert, but I've read enough to know that diabetes and insulin resistance, metabolic dysfunction is linked to increased risk of cancer, all solid organ cancers. And it seems that that's related to at least partly to oxidative stress, chronic inflammation. We all know that cancer cells are dependent on glucose and glutamate for thriving, and those things are certainly abundant in metabolic disease. So it makes sense.
Absolutely. Go ahead with vascular and endothelial dysfunction, excuse me.
Yeah, it's again, I think it's all related to the impact that the AGE LDLs have on endothelial cells and endothelial function and nitric oxide production. Again, it's just a milieu for setting you up for dysfunction of those endothelial cells, which a lot of people believe is the root, sort of one of the big root cause of atherosclerosis, is it doesn't happen without endothelial dysfunction, and or functional impairments in the endothelium. Again, related to, say, for example, increased transcytosis of LDLs into the endothelial cell.
You bet. And as you're aware of, because you've had the pulse cardiac test and sat in with my year over year, I mean, much of that is all centered on what's going on in the endothelial and measuring what's happening in those soft plaques and what's going on there. Also, just like to mention to anybody, we're now seeing for 20 plus years, you can't turn on the TV without seeing a Cialis or a Viagra commercial out there. And guys, if you're starting to experience, even if you're in your 30s, early 40s, any erectile dysfunction, that's a heavy duty sign that you've got plaque forming in that part of your vasculature and keeping you from getting the erection that you want. And you could, even with sometimes an X-ray, that can be found. I've seen that happen before, but also with, peripheral artery disease, everything going on with the vasculature, these advanced glycation end products. And just think about it. We've become, I believe that 80% of the population is on the spectrum of sugar addiction. And if that's happening, it completely explains why we're having the epidemic of erectile dysfunction in the last 20, 30 years. Anything left to add before I go to the next slide?
Yeah, another epidemic, which just goes along with the other epidemics. So if you're suffering from ED, get your metabolism checked.
And get a CT heart scan. So here, damage to the pancreas and beta cells. Well, yes, every place that, the pancreas is just, again, a bunch of protein is an organ. Everything in the body is going to be impacted with all of this. And those can actually accumulate on the beta cells, which creates the dysfunction that it can't create enough insulin going on. So you've got a double whammy that, high insulin can be driving issues with a lot of this stuff. But then if you're high sugar all the time, high glucose, you can be forming advanced glycation end products right on those beta cells and not allowing proper insulin creation. And so, yes, sometimes people that we are believing are type 1s because they're not creating enough insulin wind up reversing it because they were just so insulin resistant. And as they can get rid of these advanced glycation end products and allow the body to heal, suddenly the normal beta function can return. So would you like to jump quick on mineral homeostasis?
Yeah, here's another one. I didn't realize this, that AGAs can interact with minerals, calcium, magnesium, specifically listed here, affecting their absorption. And I remember absorption, utilization, and storage, but I remember in my 30s and 40s having sometimes problems with muscle cramps, and somebody told me to take magnesium, and I've been taking magnesium since my 30s. It probably was because I had this problem, and I've just continued to take magnesium, even though I don't know if I really need it anymore, but I still do.
Well, actually, it's part of the protocol we've both been following for the heart for 5 years, so I'll take it to the day I die. So liver damage and fatty liver disease. I just had an excellent podcast on the My Metabolic Life channel with Kim, and she is a lady who reversed, her mother and brother both died of unresolved fatty liver disease that moved into cirrhosis and cancer and killed both of her mother and her brother. And she went down this rabbit hole and figured it out for herself. And through the help of Dr. Sarah Hallberg right here of Virta Health fame, wound up in retirement. Kim in her 60s went back to college and got a degree in dietetics and nutrition with a focus on ketosis, with the help of a lot of literature through Dr. Sarah Hallberg to create that kind of an emphasis. But she was able to completely reverse her fatty liver disease. And this was something that took out 2 members of her family. So, again, just as it says here, leading to fibrosis, cirrhosis, and even liver cancer. And I now have a good friend who has witnessed and gone through all of that. Here we have at 22 another apathy, risk of peripheral neuropathy, again, numbness, tingling, very much like what we were finding from the diabetes version of all of this in the limbs happening. You want to take 23 here?
Yeah, this is interesting, because we are seeing just more and more sarcopenia, which is muscle loss, leading to tremendous disability, especially in the elderly. And when you think about insulin resistance, the prevalence does increase as we age. One of the problems is we are seeing it at younger and younger ages, even in adolescence, but they haven't had it long enough to perhaps get the muscle dysfunction and the sarcopenia. But sarcopenia in elderly is just a massive problem.
Absolutely. And everybody, we need more protein as we age to battle this. The need for protein goes up with age, not down. Anyhow, will
Yeah,
keep
so
moving your.
it's double whammy. We're protein deficient and we're AGA toxic, right? What's going to happen?
Absolutely. And, right. And then you become sarcopenic. You're not strong enough and you have a little osteoarthritis going on. And here's your risk of falls happening as you're going to break a hip and have a third chance of dying within 12 months of all of this. So it just, you can see we're having reoccurring themes that are going and working a weave into everything that we associate with aging, everything that we're going to see the doctors on in our 40s, 50s, 60s, 70s, everything's being explained by right here. So yes, if you have joint damage from from advanced glycation end products, your cartilage, your tendons get stiffer, your ability to stabilize yourself and absorb shock and handle all of these things. And it winds up with reduced motion, range of motion, and increased inflammation. You want to jump on mitochondrial dysfunction?
Yeah, all of our cells, most of our cells have mitochondria, which manage the energy, right? And so if we're having a dysfunction of the mitochondria, which is well known in metabolic diseases, related to AGEs, then we're going to have cells that are just underpowered, and it's going to lead to global dysfunctions. You can see by this list 30. What are the 30 things on here, right? It's perhaps it has a unifying theme of mitochondrial dysfunction at the level of all these tissues.
Absolutely. So 26 here, impaired reproductive health. This is kind of funny when I think back 6 years ago, because next month is 6 years of my beginning of this journey and what I refer to as breaking my brain. And one of the things that I completely discounted, one of the resources I found early on was Diet Doctor. And they had a list of like 40 different conditions that they said could resolve through ketosis with the ketogenic diet. And coming out of my disease managed background, I'm looking at this, I go, oh my God, what snake oil they're trying to sell me. And that you can just reverse PCOS, the number one cause of infertility in women. And I have seen just hundreds of female testimonials and read about them of they wound up going on keto because they wanted to lose weight. They thought they were infertile. They wound up clearing up their PCOS just by going on a ketogenic diet. So again, the correlation there, going on a ketogenic diet, we're bringing down the glucose levels, we're bringing down the advanced glycation end products and allowing here, the ovaries to function properly. So, I just laugh as I go back thinking what I used to think 6 years ago and compared to what I think now. So I'll just touch on this one really quick. I've had periodontal surgery under my lower jaw teeth here back, and this was 15 years ago, so in my 40s. And I even, right before I started all of this, I wound up cracking 2 different teeth. And but then since all of this, my last 6 years, every time I go in for a dental exam, my gums look perfect again. My teeth are strong, and they're like, yeah, you look great, you look perfect. And so I'll chop it up to a little bit of advanced glycation, inflammation, and everything else going on. But this is the root, and because I'm not putting the sugar in my mouth anymore, whether I would brush or not, it's not there to create the problem and break down the tissue and break down the teeth. I'll let you go after red blood cells.
I also had some oral issues and dental concerns over the years, and I actually just saw my dentist this morning, and he said everything is great. So completely stabilized gum recession, right? So I had early and progressive gum recession. People aren't familiar. You don't want your gums to be more than 3 millimeters. Is it 3 millimeters or 3? The measurement, I don't think it's millimeters. It's 3 something, whatever they measure.
I think it is millimeters.
From the gum to where the gum attaches to the tooth, whatever that measurement is, they just say you're a 3 or you're a 4, right? You don't want to have 4s and 5s and 6s. You want to be 3 or less, right? So I'm all 3s right now. which is basically kind of almost reversed it, because I had some 4s and some 5s even earlier. Yeah, I mean, again, it's just, the AGEs affect all the cells, even your red blood cells.
You bet. We've touched on
You
number
wonder
20.
you wonder why we have an epidemic of people complaining of shortness of breath. And it's an epidemic of shortness of breath. I'll tell you, this is real. All the time people are coming in, and I just feel miserable. I'm short of breath. I can't exercise. But you don't find anything else objective, right? Their pulmonary function tests are good. Their heart's, not bad, stable. But they have this progressive shortness of breath. Red blood cell dysfunction and anemia, folks.
Well, and potentially C15 dysfunction from our last video, or
Right.
lack of C15 for integrity of the membrane of those red blood cells. So we've touched on already much to do with the GI, but guys, you have to also appreciate how important your GI tract and your gut microbiome is to, your dopamine, your serotonin. These things, for 90% of them, are generated in the gut. And again, this high glucose, this high sugar, it has lots of different issues related to, also, if your gut health goes down, where we talked about immune system before, so heavily tied. The two things that kill your immune system most: sugar and alcohol. And I'm just going to do a quick thing here to jump in with this, because we just went through Halloween weekend. So we're going through what I call the cold and flu season. Is not the cold and flu season. It's the Halloween. It's the Sunday football games. It's the Thanksgiving. It's the Christmas and New Year's. We go through candy, pie, and excessive eating and drinking through all of this period of time. And the kids with the sugar high of 2 months to get through all of this candy for the next month or whatever it takes. This is where the cold and flu season's coming from, because ever since I've done this 6 years ago, I haven't gotten a cold or the flu or anything. And I used to get real bad bronchial and other, major flu things wiped out once or twice a winter. And I've been perfect ever since the last now 6 years.
Yeah.
So last but not least, number 30 on our list here. Again, negative effects of skin healing and elasticity beyond aging. This ties into two other things that were tied in here, so we don't have to deep dive on this. Before I ask Ryan here I'll give you a quick minute as I tell this last story I mentioned earlier before we recorded, and I told you I would end with. I'll give you a chance to think of your ending comments of this and bring it home for us. So when I first went on my journey 6 years ago, I wound up writing what turned into a 68-page Word document, kind of going through, here's what I learned, here's where I learned it, and all of these things. And at the end of I kind of ended the document, and when I was kind of coming in for a landing on writing all of that, I confessed to Ryan earlier that, I've always had kind of an affinity for cooking shows ever since I was a kid. And I was watching this one barbecue cooking thing back in 2019, fourth quarter 2019, as I was writing this document guide that I wrote. And it hit me, because they're saying, okay, now if you really want to tenderize your meat just perfectly and just make it so that it just dissolves and get rid of all of the connective tissue and everything going on, or if you have tough pieces of meat, the number one way to tenderize this is pour a 2-pound peg of sugar over it, let it sit in there in the refrigerator overnight, and you're going to come back the next day, and the sugar is just going to pulverize everything going on inside of this meat. It's now going to be the softest, easiest to break up meat in the whole world. And I'm watching this and I'm going, oh my God, everything that I'm learning about what's happening with high glucose, high A1C, flowing through the body is destroying everything we just went through with these 30 different conditions. And you can go and add on to ChatGPT and get 30 to 40 or 31 to 40 and 41 to 50. And you can keep going with this, because this is not an all-inclusive list. I just decided to stop at 30. But people, this high glucose over what the body produces naturally on its own, I believe is one of the major things that's damaging us everywhere. And that's why, yes, I try to make sure I stay right here with my glucose, which keeps my insulin right here too. Ryan, I'll let you bring it home, and you can put the final knife in the steak of advanced glycation end products.
Well, first, I just want to thank everybody for listening and sticking with this. This is a long list, but wow, what an impressive list of all the things that can happen from AGEs. Please, everybody, take notice of this and get this information for yourself. Know if you're insulin resistant. If you have any evidence, any markers to indicate abnormal glucose metabolism, you need to get that fixed. And it's very simple to do. It just requires some nutritional adjustments, and you can get your glucose down. And then get yourself insulin sensitive. That can be a little bit of a bigger challenge. It's not just nutrition, it's a lot of different things. But what people need to know cardiovascularly is that LDL requires modification, right? You can lower, if you go to your doctor and you have elevated LDL or ApoB, they may tell you to go on a statin drug to reduce it. And that's not necessarily wrong. You can, there's individual circumstances where that might provide a benefit. It's kind of like the truck on the freeway analogy. If you have fewer trucks, you're going to have fewer accidents. But does it fix the underlying broken metabolism and physiology? No, it doesn't. You can have atherosclerosis happen if you have a milieu of structurally changed qualitatively modified LDLs with an environment of heightened thrombosis, heightened inflammation. You can get atherosclerosis with LDLs or ApoBs in the 20s, 30s, and 40s. Don't let anybody tell you that will not happen, because that's bullshit. It happened to me.
Have you seen it happen anywhere, Ryan? Are you aware of any of that?
Oh, myself. Right. Yeah. So fix your underlying physiology, folks. That's the message.
All righty. Well, everybody, thank you so much for joining us today. We mentioned, or we brought up that Ben Bickman had a great short little YouTube. It's only 5 minutes long to listen to. I'll put that down in the show notes. Also, Nick Norwitz had a great one on what he called brain oozing. There was a new paper out in Nature talking about really what's going on here, happening in the brain, and how that's changing many aspects of what we believe is also leading to obesity and the inability of the brain to connect with the GI tract and everything. But it basically is coming down to advanced glycation products here. So it just keeps going and keeps going and keeps going. And we could talk for hours and bring on 100 different things that are going on. But hopefully with all of this, you've seen what's happening. If you or a loved one or a friend is talking about these types of things with your doctors, this is very reversible. Share the video. Come to my website. It's all about metabolism, fixing, becoming insulin sensitive, bringing your glucose down, and happy to help you. So thanks a lot, Ryan, and we'll sign off. And now we got to come up with another topic, hopefully within the next week. All right, everybody, you have a great week, and thanks for joining us.